Hello, good afternoon, everyone. I'm going to start with a few slides of just overall numbers, where we're at globally, where we're at here in the US, and then I'll start paring it down to the state of Iowa, Story County, and then Mary Greeley Medical Center. There should be plenty of time here at the end for any additional questions that I may not have answered during our time together. So please don't be shy. I'm here to help answer any of the questions that you have. And like I said, I'm so happy to be here. So thanks for the invite, and just let me know if or when you want me to do it again. So what you're seeing here on the screen, COVID-19 numbers. I actually started this for our Board of Trustees back in March, and you can see the incredible increase in numbers since March 30th when I started tracking this on this spreadsheet here. I want to point out the specific increase in growth, though, between October and November. This is what we're seeing on the news right now. It's what we're probably all feeling here in our community as well. The incredible increase here in the United States, and then certainly within Iowa, has been staggering. And I will share what that means for Mary Greeley here in just a little bit. But way back in March here at Mary Greeley, we had served 3 COVID-positive patients. To date, we are actually over 310 discharged patients here at Mary Greeley. And so that 309 are just the ones that we admit to an inpatient unit. This number is far larger for those patients that we serve within the emergency department, but we have had 310 hospitalized patients at Mary Greeley since the beginning of the pandemic. So looking at our global stats, this map I actually get from the New York Times. They have a nice coronavirus page. I would recommend that you access that if you haven't seen it already. And it does a nice job of color coding what's going on globally. The nice thing, if I look at this graph today and the graphic that I pulled up last week, everywhere but the United States and Europe is getting lighter, which is good. We want to see those really pale yellows on here. That means that community spread, or the average daily cases per 100,000, is quite low. The areas that you see, the dark purples, the reds, almost that black color, that's where the number of average daily cases per 100,000 people is incredibly high. And so you can see Europe and United States, unfortunately, winning that race at the moment. Globally, we do have over 58.7 million confirmed cases. There is also over, at this point, 1.4 global deaths. And if you're wondering, how does the U.S. compare to other countries? We're also the highest in number when it comes to confirmed deaths. Confirmed cases, so 12.2 million. Same graph, but then I narrowed this down to the United States. Once again, I pull some of this information for our Board of Trustees. That map there on your right is the exact same graphic that I showed our Board of Trustees back on October 26th. At that time, I was appalled. I said, my goodness, look at the Midwest. We are red, and it was shocking at that time. Fast forward almost a month. Very shocking now. The entire United States is in that dark orange red color, and the majority of the Midwest is now into a purple, almost black color. And once again, this is just number of daily cases reported per 100,000 people. So it's really talking about the density within your community. And right now, the United States has a very dense COVID-rich population right now. Some additional information, if you haven't been tracking just the newly reported daily cases here in the United States, I'm sure you all remember back in the summer when we started hearing about Arizona, California, Texas having those incredible increases in numbers. That's that blip you see there for July and August. And then look at where we're at now. So where we're at today compared to when we saw that New York surge back in March and April, when we saw the surge in the summer, compared to now, it's not even comparable. We are far higher than we've ever been. Maybe the good that's coming out of this is we know how to care for these patients. There's new treatments. We certainly understand the disease process better. And so the new reported deaths by day in the United States, in comparison to the hospitalizations, is certainly less. And so we saw a high death rate in April and May, and that is leveling off just a bit. And so right now, what we're seeing, obviously everywhere is high, but it's substantially higher here in the Midwest. This is a busy graphic. I'll try to walk you through it just a little bit. But this is talking about the cumulative case count per capita at the peaks. And so early on in April, that's when we saw New York, New Jersey, that East Coast really on the news. And it was devastating. If you look at the case count at that time, it was about 1,500 individuals per 100,000 that were becoming positive. Fast forward to summer, we saw even a higher case count per capita. Now, if you look what's going on in November, it's 4 times higher than what we saw in July and almost 7 times higher than what we saw in April. There are many COVID positive individuals walking around our communities right now. And you can see from those November numbers, the majority of the states with these super high numbers all are in the Midwest. And then you can look on the right-hand side of the screen. These are the states that are doing quite well. And so there in November, you can see even some of the states that are doing better, like California, Pennsylvania. If you look back at that left-hand side, those, look at Arizona, it was 2,300, and that was super high, super devastating for that state back in July. And now the states that have the least amount of density within their community are seeing those type of numbers. And so it just shows here, as a nation, we certainly are seeing incredibly high cases. So what's going on? State restrictions, if I would have talked to you back in April, we would have said almost every single state was shut down. Restaurants were closed, fitness centers were closed, businesses were closed, people were working from home. During late spring, early summer, states began to open back up to a different degree, of course. And then what we're seeing right now is the majority of states are tightening restrictions back up. And so those are all the states there in that purple color. That's stating that these states are taking additional measures to keep us all safe. The ones in the yellow, so maybe down in those southern states, the reopening, they had plans to continue to reopen, but they've paused those plannings. So the restrictions are staying as is. And there's a few states that have lifted restrictions. So that's where you see the Florida, Tennessee, Missouri. And then the gray would be restrictions in those states are unchanged. I did grab this graphic on Friday, though, so if we would look at it again today, I'm sure those would change just a little bit based on the numbers coming in. Okay, so now let's start focusing on the state of Iowa just a little bit. It's that same color-coded graphic there. About 3 weeks ago when I looked at it, the majority of our counties were that very light, pale yellow. So this too has changed substantially within the last few weeks. Maybe the positive is that graphic there on your left is showing that our 14-day change of number of cases coming in, it is on a decline. So we have seen 7 straight days of a decline in our state positivity rate. So that 14-day positivity rate has been slowly declining over the past week. We still are seeing increased hospitalizations and increased deaths within our state, however, when compared to 14 days ago. So Iowa hospitalizations, incredible. I always tell the story. About 4 weeks ago, I was on a conference call, and at that time, we had hit a new hospitalization high for the state. It was 451 patients were hospitalized. We were all shocked. We were scared. We were saying, wow, that is an incredible amount of COVID positive patients within hospital walls. Fast forward 4 weeks, we hit a high of over 1,500 just about a week ago. So these numbers are staggeringly high, something we have never seen before here in the state. They have been on a slight decline here within the past 5 days, hovering around 1,300 hospitalized patients. That ICU patient count has also kind of hovered right around that 270 mark. So get a lot of questions on who's hospitalized in the state. Is there truly just one age group, or what does that look like? So the Iowa Department of Public Health now provides this information within their website. And if you look here, the majority of those Iowans that are hospitalized right now are in the age group of 80 or older, followed closely by those between 70 and 79, and then 60 and 69. We have seen, though, a pretty substantial increase in our young children and then those college-aged or young adults. And that has been fairly new. So we're keeping an eye on that. We're hearing from University of Iowa and then some of the Des Moines hospitals with the pediatric units that they are starting to see quite an increase in those younger populations. This graphic, one of the Iowa State professors helps track this data and pulls it together quite often, and this is from her data that she is gathering. She also gets this information from the Iowa Department of Public Health. And what this graphic is showing us is that early on, that middle pink color, so that very top part of the graph, you can see the number of hospitalized patients within the state of Iowa. And so we saw a little blip in April, a little bit again in August, and then this incredible increase here in late October and November. So yes, that's increasing. What's happening though with the intensive care patients and the ventilator patients is quite an interesting story. So ICU patients is that light pink. That has stayed fairly stable for the number of patients that are hospitalized in the intensive care unit since they started gathering this information in mid-May. Same for our vented patients. It's a fairly steady line. And I do attribute this to we know the etiology of the virus better. We know how to care for them a little bit better. Here at the hospital, we've seen a little bit of a switch that we're caring for more patients on our medical unit and maybe a little less in our ICU when we compare it to the percentage of the number of people that we have hospitalized. So Story County, I took this graphic, I believe it was 2 days ago, and I'm happy to share that our percent positive right now for the 14-day average is at 13% right now. So Story County has also seen a nice decline in that 14-day positivity rate. Some of it is attributed to a pretty significant testing campaign that Iowa State University did for their students. So last week, they tested upwards of 700 students each and every day. Prior to those students going back home. They wanted to make sure their students understood if they were positive or negative before going back to their community. And overall, they tested approximately 3,000 students during this campaign, and their overall positivity rate for those 3,000 students was about 6.1% positive. So that was much lower than what we were seeing in our own communities. And this information, we have a Story County Public Health dashboard, and we track on there just the 14-day percent positive over the last 30 days. So this isn't new. I'm sure you could understand this yourself, but we were sitting really nice in about a 6% positivity rate, which probably isn't all that nice, but compared to now, it was very nice, about a 6% positivity rate up until November. And then we started to see that pretty significant climb here in the county. So switching gears just a little bit, I want to talk about other things that we have going on here in Story County. One of the items that we like to touch on is Test Iowa. I'm sure you've seen it on the news. Right now, the state has 5 Test Iowa sites. You can see those counties listed there in the presentation. This is down from 8. They did have 8 in October. They did close some of their clinics because of the cold weather. They consolidated a few down in Polk County. These sites, they're completely organized and run by the state. And so they provide the funding, they provide the staffing, they provide the location. Our Story County Board of Supervisors back in July issued a resolution to the state asking them to bring a site to Story County prior to our students coming back. We really didn't ever hear back from them with that resolution, and so we kind of took matters in our own hands, and Mary Greeley helped develop and lead a Story County Test Iowa clinic. Could not have happened without the collaboration of many businesses and partners here in the community. But right now, the state has 21 Test Iowa clinics. Back in September, there were only 7 in the state. So these are the Test Iowa sites that are really growing in numbers. And this is when someone like Mary Greeley partners with the state. And so the state is providing us the supplies and equipment. They supply the PPE, all the testing swabs. We do get a slight reimbursement or a small reimbursement for the testing that we do. And then they also transport the test down to the state hygienic lab. What we do at Mary Greeley is we provide the location, the staffing, the scheduling, and the coordination. So anyone that wants to get tested through Story County Test Iowa Clinic has to first fill out a QR code, and then they'll call us and we'll get that person scheduled to come and get tested within our site. Got a little ahead of myself, but here's the graphic, and I'm happy to share this with any of you. I know Melissa will be sending this presentation out to all of you as well. But if you need tested, this is an excellent way and something that's available to you and anyone else here in the state of Iowa. So the only stipulations to get tested at one of the Test Iowa sites is you have to be a resident of Iowa. So a lot of our students, they may have a residence in Minneapolis, for example. But when they're at Iowa State, they live here in Ames. So they're putting down their current resident and they are going through our Test Iowa Clinic. The other thing that you have to do prior to coming through a Test Iowa Clinic is you have to get onto the testiowa.org website, and there's an assessment you fill out. It's going to ask a little bit about your demographics, any of the signs or symptoms that you are currently experiencing, and then that step 3 is calling us to make an appointment. So there is an 800 number that's available on that website or on this graphic. Call us, we'll get you scheduled, and the results take anywhere from 24 to 72 hours. Up until Monday, the results, I would say, were always about 24 hours. Monday, we saw a little delay, but we're back up to about 24 hours now, back down. So what have we done? I took this graphic earlier in the week. We have now almost surpassed 6,000 processed tests through the Story County Test Iowa Clinic. We did over 400 tests on Monday, which is very exciting for us because we want to be there for all of you, for the community in their testing needs. We have seen increased need with the increased percent positive within our community. You can see there on the right, we were humming along with about a 6% positivity rate in most of October. And then just like everything else in November, we started seeing a pretty drastic increase in our percentage positive. November 20th, I did just look at those numbers. So on November 20th, we had an 11% positive rate. So I'm hopeful that that will be a new trend and we'll start seeing a trend down for the number of individuals coming through that test positive. And then if you're wondering, who are we testing? So like I said, you really just need to reside in the state of Iowa, and we have heard stories of people driving as far as 2 hours away to get tested. It was their only option at the time. There's a lot of individuals that will call these sites and clinics. They're very full, and so they'll select the one that can get them in. And unfortunately, sometimes that means people are driving quite a long ways away. But the majority of the people that we are testing are from Story County, followed then by Boone, Hamilton, and Polk. All right, so what's going on here at Mary Greeley? I did this slide yesterday. Happy to report that currently we have 25 patients that are admitted. We have 8 right now in the intensive care unit, down to 4 vents, so not 5 anymore, 4 vents. And then on our medical unit, that's that 6B that you see there, that is for our medical treatment or our medical care, and that unit is down to 17 patients right now. We've discharged a total of 310 patients. We have had 31 deaths here at the organization. Employees, I'm also happy to report that those numbers have come down just slightly. So when I did this yesterday, we had 45 employees that were currently off, or about 3% of our workforce. Today, that's closer to about 35 of our employees off. We have 22 employees that are currently positive and at home. And overall, we've had a total of 123 employees that have tested positive since the very beginning of the pandemic, and that's about 9% of our workforce. And the majority of those have recovered and are back to work. We have had no deaths from any employees, though, at Mary Greeley. And the majority, if not all, of the ones that are positive were not traced to a work exposure. So these are happening out in the community. So I get this information from that same Story County Public Health dashboard. Once again, it's just that 30-day time period. And you can see we were staying pretty steady at about 10 hospitalized patients on any given day. And then come that early November, we started to see a pretty significant shift up. And that significant shift up means that we had to revise and dust off some of the surge plans that we had in place. So what I'm showing you here, I just want to make sure you all understand this is what we have in place today. It may have to look a little different come even this weekend. It all depends on what's going on in other departments here at the hospital and certainly what our staffing is looking like. But right now, we're saying we're in a phase 1B. So we have that 6th floor that you can see there. So it's split into 2 separate units. We have a 6B unit that can handle 15 patients at any given time. And then we have a 6A unit that can also handle 15 patients over time. So the entire 6th floor, we can handle 30 COVID patients up on that floor. Up until this early November, we've always been able to handle all of our COVID medical patients on the 6B side of that floor. So we were always 15 or under, and at that, we were conventional staffing, and we're calling, that phase 1A, that's green. That's just what we do every day here at Mary Greeley. We've moved on to 1B, so all of the COVID patients are now still on the 6th floor. However, this means we had to move our surgical patients because 6A, up until just recently, was our medical surgical unit. So any patient coming in for surgery would be admitted to the A side of that floor. They can no longer be there because we have COVID patients now on that unit. And so we have moved our surgical patients down to other medical floors at the organization. And that's why we have a contingency on there. So that's why we're saying yellow. We're still able to handle the capacity. We're doing okay. But our care for COVID patients is a little bit increased. And so we do have to have additional staff on those COVID units to help run, to grab things, to help turn patients. And so we have a little bit extra staffing on those units, and then certainly the extra surgical patients on our medical floors, which would be atypical for us. And then the rest of the phases, I'm hopeful we don't ever have to be there, but we're ready. And so once we fill up our 6th floor, we have several other options here at Mary Greeley. Beds, I don't think will ever be the issue. It's the staff to go along with the beds. So we'll begin filling other areas, other medical units of the hospital as we would need to. And then we would have to come up with different staffing scenarios. So if we ever get to a point where we don't have staff to care for our COVID patients, that would be an additional trigger to pull back on any of the elective procedures that we're doing here. So we may have to pull some staff from our ORs or GI to go help up on some of those COVID units. And then as it relates to our ICCU surge plans, they are 2 different areas. Our ICCU can handle 14 patients. We have 14 beds right now. And so we're saying 1A is COVID patients of 7 or less. That's just because we typically staff for about 7 patients in the intensive care area. So once we get over to 8 or more patients, that's where we have to have additional staff float to the ICU. It doesn't mean we're not able to handle it. It's just time to start watching what's going on. So right now we have over 7 patients in our intensive care. So we're in that 1B kind of contingency yellow phase. If or when we get close to 14 patients, which we did see in the last few weeks, we have other options. So we have a few other areas that have all the critical supplies and materials we need, and they are ready for us to overflow. So the next overflow area would be our holding room. That's down actually fairly close to our intensive care area, and it can accommodate 4 ICU patients at that time. And you may have additional questions about our surge plan. So once again, write them in the questions box, and I am happy to get that information out to you. I'm going to step back just real fast about surge plans and hospitalizations in the state. Mary Greeley is doing well. We've been able to have the staffing, the beds to care for the patients coming into our hospital. University of Iowa, some of the Des Moines hospitals, those larger systems are truly at capacity. And for example, University of Iowa is on their 4th stage of surge planning. That's saying they've overflowed their capacity 4 times. And so the planning that they're doing in some of these larger hospitals is truly incredible. And the teamwork with all the hospitals here in the state has been incredible. If or when we would need an extra ventilator, which has not happened, but if or when we need to, truly all we would do is call around to our local partners and we share supplies. And so that is always part of the contingency plan too, is we work together as a hospital system to make sure we're able to care for the patients that make the most sense for that location. Okay, switching gears again just a little bit. I still get asked quite a bit about testing. So what's available to us? Why can't you just go to your doctor and get a test that same exact moment, the 15-minute turnaround? So I'll talk a little bit about what Mary Greeley has. Cepheid, it's the vendor. This is an in-house test that we had starting in April. We did have a specific number allocated to us each week, but it is a rapid turnaround. Unfortunately, this vendor stopped making a COVID-only test come November, and they added a whole bunch of other viruses and panels to it. So we said, no thanks, let's not do that right now. So we crossed that option out. Abbott is another vendor that we have. It's another PCR test, which the Cepheid was. It's also an in-house test, rapid turnaround, and we have some here on site. The thing that makes me a little nervous about the Abbott test is Abbott has contracted with the federal and state governments, and so their first priority is sending the testing kits to either the federal level or the state level. So they get them first, and then we kind of get anything left over. And it's worked. They're sending us an allocation, but they can't tell us how much every week they're going to be able to send us. So I'm always a little nervous that, hey, there might be a week where we just can't get any of these tests. We should have a better understanding come January 2021, and we can actually hopefully get in contract how many of these tests we're able to get. We also have several other options. A BioFire test. This is one that's great for diagnostic. If someone walks in with pneumonia-like symptoms, this vendor allows us to test for a variety of respiratory viruses all at once. So it can tell us what type of illness this individual has. We also have some antigen tests now in-house. This is a very quick turnaround. They're great for understanding the positive. So when you get a positive antigen test, you're fairly confident that, yes, you have COVID. The limitation with some of these antigen testing is the false negatives are a bit higher. And so if a patient walks in, has a negative antigen test, our providers will generally then use one of these other tests to say, is it really negative? Because they sure sound like it. Maybe their CT really looks like they have COVID, or maybe they really sound and their symptoms mimic what COVID would be. So then they could use one of these other tests to really help us understand, is it positive or negative? And then Corteva, this is an external reference lab. It's a saliva test. So if you have had any procedures here at Mary Greeley, you might have come through our pre-procedure clinic about 72 hours prior to your procedure. You spit in a cup, and then we send it down to Johnston, Iowa. And that is who we use for that. And then we also have that Test Iowa testing for anyone here in our community, including our own employees. So what's going on with visitors at Mary Greeley? We do allow one support person per visitor at a time, and that's the base level. We understand there's always situations where maybe one additional person needs to come in. Certainly some of the exceptions that we have are patients that are end of life. We understand that they would need more than one support person at the bedside. For our pediatric or minor patients, they can have 2 support peoples there. But we really want to limit it to those that are important to the care of that patient. We've learned many things through this pandemic, and we now understand that patients' outcomes can be better when that support person is at the bedside with their loved one. The support person is there hearing the discharge information, hearing the information about their disease, and can help in the care of that patient once they are discharged to their home or to their care facility. So we are very dedicated to staying open for these support persons at the bedside, but we also ask that these support people wear a mask at all times when they're here at Mary Greeley, that they don't congregate in waiting rooms, that they try to stay in that patient room whenever possible, knowing that they're still going to have to eat, so they can come to our cafeteria, they can go to the coffee shop, and certainly restroom breaks is very much allowed. But we do ask that the visitors stay in the patient room and then wear a mask. Supply updates. I would have talked to you quite a bit this summer about all of our needs. However, the vendors have caught up, the systems have caught up, and all of our critical supplies at this time, we have at least 30 days of supply on hand. So this is much less of an issue than we once had. Certainly something we still keep an eye on every single day, though. Then something new, the governor's proclamation. Last Monday, she came on to primetime TV, 6 p.m., and made a proclamation. I'm sure you all are aware of it. Part of it is that mask mandate for when you're indoors within 6 feet for longer than 15 minutes. One of the items in her proclamation that really impacted the hospitals here in the state is our elective inpatient procedures. So for any of these procedures that's not essential or critical to the patient to do exactly at this time, the state and the governor are saying, hey, let's reduce those elective inpatient procedures by half. This will open up some of the beds that we so critically need for our medical patients. So we've asked our surgeons, hey, help us out, decrease by 50%. Their response has been fantastic. We have such good providers and surgeons within this community. And our goal at Mary Greeley, we averaged about 10 surgical admissions every day of the week, and so our goal is about 5. And then vaccination updates. Come back tomorrow and I could tell you a whole different story. Things are changing very, very quickly with vaccinations. The Iowa Department of Public Health has developed a COVID-19 vaccination strategy. They're working with the local health departments for community vaccination plans, hopefully coming very, very early in 2021. We do know right now there are 2 vendors, Pfizer and Moderna, that have already completed some of their trials. They are very effective, and Pfizer just applied for their emergency use authorization, and we expect to have those vaccinations in Iowa as early as December 14th. And so what we know right now is the first set of vaccines will go to the critical workers and those at highest need. And so we're trying to understand, because there's no real definitions out yet. We know healthcare will be one of those essential jobs that will get some vaccinations. We just don't understand, is it all of our healthcare employees or those staff that are truly at the patient bedside? So once we get better clarification on that, we'll continue our plans. Long-term care facilities will also be an area of focus in this initial round. And the government has actually partnered with CVS and Walgreens for this distribution. So those pharmacies will get the allocations of the vaccines and will help those long-term facilities, or long-term care facilities, do the vaccinations for the residents. And then finally, I don't expect you to read the graphic there on the right. It's very busy, but this is some of the work that we're doing here in our community. We all see the Cyclone Cares messaging on Cyride buses, on sidewalks, in businesses. That has been the main focus for AIMS on getting the message out about safe practices for COVID. We're also putting things out about how to celebrate safely during our holiday season. And then Dr. Fulton there on the left, he continues to do remarkable work in reaching out to our public. So this video he did back on November 10th. I know it's reached over more than 75,000 individuals right now. And it's just an incredible video. If you haven't seen it, go to the Mary Greeley webpage and search for this presentation. It's very informational. And we will continue to have Dr. Fulton do these public service announcements every now and again. And then finally, I'm sure I'm speaking to almost everyone here on this webinar. Your support and the community support has been amazing. Truly, our staff could not have gotten through this pandemic without the community support. Each and every day, there's new notes of gratitude. There's food for our staff, especially recently. I would say every day there's a new restaurant that's delivering food, or today I saw cookies sitting in my office. That means everything. So thank you. Donations are also plentiful, and we want to put a little plug out there. If you're still looking for ways to help, feel free to go on to that mgmc.org/donate site, and we would love anything you can do. We're going to use that to help our staff get through the pandemic. Some of the money right now is going towards rest and relaxation, almost like Zen type rooms for our employees. And it's really just a space for these employees to get away from the stress of their work for even 5 minutes, to go decompress, relax, and then go back to the patient floor. So thank you for that. All right. That was a whole lot of information, and now it's your turn. What did I not answer, or what did I not clarify very well? And I believe this is where you can go into the chat box. Is that right, Tim? Is that where you wanted to put it?
In the questions box.
In the questions box.
And we have some questions, and
Okay.
I'm trying to find them a sec.
We're trying to find your questions. Oh, they're down on the bottom there, Tim. All right, and Tim, I can probably, will this be recorded? Yes, this is going to be recorded and sent out to the group. And we actually had a conversation on, does this go to all foundation people on our mailing list? And so I think, yes, we want to share information. One of the things I did not talk about is we want to get information out to the public. However, our hospital speak is sometimes very confusing. So we're trying to make it easy to understand, and we'll have some additional information coming out on Monday. So we're going to have a color coding system, kind of like the national security alert. So are you green, yellow, orange, or red? We'll put that on our public page, and then we'll also have definitions of when we're in yellow. What does that mean? Why are we in yellow and not green? So we'll be sharing that here soon. The next question, how are ISU student numbers counted into the Story County numbers? They are. And so it depends on where the student says they reside. And Iowa State does encourage the student to say, you are residing in Ames. Designate Story County as your place of residence right now. So the majority of those are being attributed to Story County numbers. How are the hospitalized cases from out of the county counted into those numbers? They're not. So if a patient is hospitalized from Hardin County, for example, their positive number will be attributed to Hardin County. However, they're still in our hospital walls. So if you would go on to the IDPH website right now, there is a place where you can see hospitalized patients. And if you would look right now, it would say for Story County, we have 8 patients hospitalized. Well, that's not true. I mean, Mary Greeley has far more than that hospitalized. However, we have 8 patients from Story County hospitalized. So the state of Iowa does attribute your residence to your positive case. It's always confusing me when they give them all separately in the newspaper. I know. And there's way smarter people than me that look at this data and do amazing things with it. But it can be very confusing. Why are the larger hospitals so overcrowded yet aren't near a high population area? So like Iowa City. So these larger hospital systems, it's all based on referral patterns. And so Mary Greeley, as I just said, 8 of our patients are from Story County. However, we support 14 additional counties outside of Story County. So we have several transfers from Marshall County, from Hardin County, from Boone County, Carroll County, and that's our market area. So these smaller hospitals maybe don't have the same critical care capacity. Many of these smaller hospitals don't even have an ICU. So once their patients get to an acuity level where they need additional care, they do refer them to these larger health systems. And University of Iowa, Unity Point, Mercy's, they have many affiliate hospitals. So once their affiliate hospitals can't care for the patients, they funnel them to the larger systems. If something is designated for federal or state, who actually gets it in Iowa? What is our federal or state hospital? Do we have one or no? So I think this was maybe related to my comments about testing, because that one vendor, Abbott, had dedicated most of its supplies to the federal or state level. So how that happens is the federal government has a little stockpile, whether it's PPE or testing, and then they funnel that down to the state system. So once it's at the Iowa Department of Public Health, Iowa Department of Public Health then designates it to the county health departments. So if Mary Greeley ever gets into a situation, which we have for like PPE, we had a gloves need probably 6 or 7 months ago. We went to Story County Public Health and said, goodness, we cannot get gloves anywhere. Story County Public Health works with IDPH, who works with the federal government, and lo and behold, we got a few gloves. And so that same method works for the test as well. Sometimes we don't get it though still, because they're working with all the counties here in the state, but it is a good process. Why is the 15-minute exposure recommended when it seems one could be exposed in less time? So yes, CDC actually changed this guidance about a month ago. IDPH, or Iowa Department of Public Health, has not changed their guidance yet. But what CDC explained is it's 15 minutes total. So it's no longer at one exposure. It's within a 24-hour period of time if you are exposed to that one positive individual for longer than 15 minutes. CDC did a pretty fascinating study at one of the penitentiaries where some of the guards were getting sick, and they would have these 1 to 2 minute exposures with the positive inmates over a course of 24 hours. And so that is changing just slightly, but it's about, I'm going to explain it like Dr. Fulton does. He explains COVID like glitter. If you think of your kids when they were playing with glitter, if you had one kid playing with just a little bit of glitter, it doesn't really get very far. It kind of stays in their own little area. But as soon as you invite more kids to the party and you put more glitter out there for them to play with, that glitter is going to be in every single room. It's going to be on everyone's clothes. It's going to be on all your hands. Same goes for the COVID virus. If you have your mask on, if it's just you, if you're staying 6 feet apart, the risk is very low. But as soon as you start bringing more and more people in for longer periods of time, you have greater risk for more glitter all over yourself. Explain the graphic at the beginning. What is an exposure when away from the primary bubble? Yes, so let me go to the very beginning. This graphic is all about, we all think we're safe. Like if I look at my bubble is my 4 additional people that I have in my home. It's my 3 kids, my husband, and myself. I walk around them obviously without a mask on most of the time. And then I come to work. And so I have an additional bubble with the 5 colleagues that I work closest to. Yes, we're wearing a mask. However, maybe there's a lunchtime, we're still 6 feet apart, but there's gonna be probably little lapses with our mask use throughout the day. And then they have their own bubble. And so when my colleague, Karen, for example, when she goes home, her bubble is her and her family. Well, we're all bringing these tiny little exposures, or let's equate it to glitter. I might have my red glitter, Karen has her green glitter. When we get together, we start exposing a little bit more. So it's not to scare anyone, because if we all wear our masks, if we all stay 6 feet apart, the risk is very low. But come Thanksgiving, if we think that, hey, I've really only been around my family That's completely false, because I've also been around my coworkers. I've also been around people at Hy-Vee and Target. And so it's saying stay safe. One exposure could certainly exponentially grow if we begin to become unsafe in our social habits. So keep your bubbles small, and certainly absolutely wear your mask, stay distanced when you are around other people. If tested positive, hopefully will not, what is my next move? Quarantine, wait and see, or take some proactive steps? Great question. So if you test positive, yes, absolutely quarantine. Right now, CDC says if you test positive, you are quarantined 10 days from your positive test. And so you are in your home for 10 days. Also, please, please, please call or follow up with your primary care provider. McFarland Clinic and other clinics around us have done such a fantastic job of following their positive patients at home. And through this, they're checking how the patient's doing, maybe checking on some of their vital signs throughout that 10-day period of time. And they have probably saved lives by doing this. For an example, we had McFarland Clinic was doing their screening of their home patients this weekend, called on 2 individuals that were at home with a positive case. The provider was kind of worried. They didn't sound very good. They were really short of breath. That provider said, hey, you probably should come into the hospital or to the emergency department for them to look at you. We ended up admitting that patient to the emergency department. Or I'm sorry, to the ICU. So the majority of patients do very well, and you're just going to quarantine, and you might get a few calls from your primary care provider, and that will be the end of it. There are a few, though, as we know, that get worse. So please make sure you're following up with your primary care provider. And then right now, those that you've been exposed to or around without a mask are in quarantine from 14 days from your positive test. So if you're positive, it's a 10-day quarantine. If those around you were exposed to you, it's a 14-day quarantine right now. What happened to the positive number of people how aren't listed as recovered? Oh, I'm guessing that was on our employee number. So the employees that were listed as recovered, those were the ones that are back at work. The ones that were not listed as recovered, they're still homesick. They're still positive. So the total number and the recovered number, if you subtract those two, it should equal the number of employees home with a positive case right now. And so great information. Is there a website location to find similar updated data? That is the million-dollar question. And so if you go out there, there's data everywhere, and it's confusing. Like I said, I'm trying to explain to the public why Iowa Department of Public Health says there's only 8 patients hospitalized in Story County. It's confusing. So it's joining webinars like this, it's getting out there, listening to experts like Dr. Fulton speak, and then really what we're trying to get out to the public next week is a little bit of information on how, as a hospital, we're doing. Please take a look starting next week, and if you have examples or suggestions on how we can make that data more informational to you, please let us know, because we certainly want you to feel in the know. And why is there such a surge in early November? I can tell you what I suspect. I think there were a lot of really fun parties over the Halloween time period. And so when I went around the city of Ames on Halloween, I'm sure like many of you, there were a lot of parties going on. And I can say even on my own street, I drove home from work that day, and there was literally a party bus on my street with probably 80 people going in and out of the bus. So I think that was a large factor in what we're seeing. And so yes, I am very concerned for after Thanksgiving. My prediction is we're going to stay pretty steady for where we're at right now, but I think by next weekend, give it, 5 to 7 days, I think we're going to see another incredible surge. And I think this surge will continue through the holidays. So please do your part, stay home, stay safe, mask up, and then celebrate hopefully come July instead. Thank you very much for the kudos. I love doing this. It's fun. How many persons at Mary Greeley have died from COVID, not just Story County? So I think that's where it was the 31 or 32, was one of the two. 31 or 32 total or patients have died at Mary Greeley. And I did not break that out from Story County. And I don't have that information right now, but 31 have died, and November has been a really sad month here. So we have seen more deaths in November. We've also seen more hospitalizations in November, but more deaths in November than we ever have. I've been told that I am symptomatic for 10 days. So if I have family members, they need to start quarantining after my 10 days. Can you please clarify? That is a really good question. So what's happening is for school districts, for example. My sister was put in this situation. Her 5-year-old son became positive. She also has a 3-year-old and a 12-month-old at home. So she and her husband were quarantined for 14 days. They are considered essential workers. She's a teacher. He works for the city. And so they were done quarantining for 14 days because CDC and IDPH think as an adult or as an older child, you know how to safely distance yourself, how to wash your hands, how to stay masked up for those 14-day time periods. What we're seeing for the school systems and for some of these really younger kids or ones that just maybe are mentally handicapped, they can't stay socially distanced from that positive family member. So like my 3-year-old niece, she doesn't know how to stay away from her brother. Even if the parents tried to separate them, she can still sneak in, sneak out. And so for these kids, it's their quarantine starts after that positive person's quarantine has ended. So that's why it's so important to follow up with your primary care provider. And then you'll also get a call from probably Story County Public Health or Public Health, kind of instructing you on the safe practices to take, because it's not super black and white. All right, other questions? If you think of anything, email Vicki or Melissa. They know how to get a hold of me. And otherwise, happy Thanksgiving. I'm thrilled to be here. Stay safe, stay masked up, and we'll talk to you soon.
Thank you, Amber. Amazing job, as always. I get to hear these presentations quite frequently, and I will tell you, I learn something every time. We're incredibly lucky to have Amber really leading the charge for us here. I will keep that glitter idea in my head. That will stick with me. So again, thank you so much. As Amber said, we are recording today. We will be sending this to our Prime Time Alive folks. I know we've got some volunteers on the line today, and we also have a good-sized email list that we'll be sending this out. But we're happy to be able to provide this information to you. We know that there is a desire for more information out there. So again, thank you, Amber. I know you're incredibly busy. Vicki asked me to do one quick reminder for our prime timers that our next Prime Time Alive program, Getting to the Guts of the Matter, Gut Health Part 2, is coming up next week on Wednesday, December 2nd at 2 p.m. This was actually rescheduled from a November time period. So if you've not signed up for that and would like to, please go ahead and register for that. But again, I want to echo a little bit of what Amber said as well. Thank you so much for all that you do for our organization. Our community support has meant so much to our staff and continues to mean so much. So on behalf of Mary Greeley, on behalf of Amber, and all of those that are taking care of our loved ones here at the hospital, thank you very much. Have a safe and healthy Thanksgiving. Take care.